Hi, Dr. John Stanton here. I wanted to talk to you a little bit about rotator cuff surgery. We get a lot of patients in here who have pain in their shoulder and complain of difficulty with raising or elevating their arm, reaching behind their back, loss of motion. Sometimes they may even feel a popping or tearing sensation in their shoulder. And I wanted to talk just a little bit about what rotator cuff surgery and what rotator cuff tears are. This is a skeleton, and it shows here the scapula, which is the shoulder blade. This is the humerus, or the arm bone, and in front here we have the collarbone. Now, the deltoid muscle, which is the muscle on the side of your shoulder up here, comes off of the arm and attaches up here to the acromion. This is the acromion. This is the spine of your scapula, and there are two muscles, one above the spine, which is the supraspinatus, and one below the spine, which is the infraspinatus. And these are the muscles that comprise the rotator cuff. So in this model here, we have that, looking at the shoulder from the back, we can see the infraspinatus, supraspinatus, and teres minor down here. This is the acromion we talked about earlier. And in this patient, or in this case, you can see how there is a sharp spur or a thickening of the bone there, that when the arm comes up, the rotator cuff may impinge or hit against the undersurface of the acromion. So often there is what we call impingement, often there is tendinitis, there may also be bursitis in the bursa underneath the acromion, as well as even a tear of the rotator cuff. Now, the biceps tendon, which is one of the tendons of the biceps, also passes up through this area and can be involved in rotator cuff pathology. Now, the treatment for rotator cuff initially is evaluation of range of motion, and if the motion is poor, then physical therapy is used to regain the motion of the shoulder and to loosen up the joint. Anti-inflammatory pills and sometimes even a cortisone injection in the space underneath the acromion can help with inflammation, bursitis, and tendinitis. If these treatments fail or do not give long-lasting improvement, then we often will get an MRI of the shoulder, because that is a way to tell if there is a tear of the rotator cuff. And if there is a tear of the rotator cuff, usually that's not going to improve just with medications or cortisone injections. In fact, repeat cortisone injections can cause further weakening of the rotator cuff. In those cases where the patient continues to have problems sufficient that they've lost their motion and they want surgery, the procedure that I do involves detaching a small portion of the deltoid muscle from the bone, about over an incision about an inch wide. The bottom of the bone is shaved to remove the impingement that we spoke of earlier. The bursitis is cleaned out, and then if there is a tear of the rotator cuff, we repair that with suture or whatever we need to repair that, and then the deltoid muscle is reattached to bone. This surgery takes about 45 minutes. It's an outpatient surgery. We have a great outpatient surgery facility, St. Thomas Surgery Center, which is about a mile from here off of Ted Crozier, and we do a lot of our surgeries over there, our outpatient surgeries. Patients come back and see us the next day, and we start them on simple exercises, and after about 4 or 5 weeks, we become much more aggressive with exercises once we've given that tendon a chance to heal. Please check out our website for other surgeries we do here at the Bone and Joint Group. Thank you.